Chairman, President Obama promised over and over again, if you like your doctor, you can keep your doctor. If you like your health plan, you can keep your health plan. And despite these repeated pledges, we know now that these statements were completely untrue. In fact, in the fall of 2013, millions of Americans started receiving plan cancellation notices. PolitiFact ranked President Obama's statement as its lie of the year in 2013. But it wasn't just the immediate loss of plans. People are still losing them. For example, in Indiana last year, 4 insurers left the exchange, leaving Hoosiers with fewer options. That's 50% loss of our own plans. Recently, I heard from a constituent of mine from Starke County in Indiana. He's had 2 open heart surgeries at Mayo Clinic that requires him to be on blood thinning and other medications, as well as periodic checkups. He had a private health insurance plan that he liked, covered his medical needs, but in 2015 it was knocked out by Obamacare. He was forced to buy a health care policy on the marketplace, but unfortunately discovered in an annual checkup at Mayo Clinic that his doctors were not in the network, and because of that, and because they were out of state, they were out. He was forced to pay thousands of dollars out of pocket for the visit, in addition to thousands more out of pocket for the prescriptions. When he appealed to the Indiana Department of Insurance, he was told there was no marketplace insurance plan that would cover his doctors at Mayo Clinic as a Hoosier living in the state of Indiana. He recently learned that his marketplace plan through United Healthcare won't offer individual market plans for his area in 2017. He was forced back into the marketplace again to find a new healthcare plan that still will not cover his out-of-state doctors. It reinforces to me that for many Americans, this law is not working as promised. And Mr. Miller and Mr. Graham, I want to direct this to you. Isn't it true that the individual mandate was supposed to increase competition on the exchanges by ensuring that people sign up, thereby encouraging insurance carriers to offer more choices and broaden those networks?
That was the stated objective, and as you've described it, it's not been the case. So I agree, I guess would be my answer.
Mr. Miller?
As I like to say, it seemed like a good idea at the time, although unlike Mr. McDonough's testimony, it's been a bad idea for many of us for a long period of time on the conservative Republican side of the aisle, just to rewrite history a little bit, going back to the 1990s. What was proposed wasn't executed. And it wasn't going to work that way because the grand design in theory did not reflect the reality on the ground. Some people gained under this arrangement. There's no question about that. If you were a low-income person suddenly getting substantial subsidies for coverage, you might not be crazy about that coverage, but you'll say you came out ahead. There are other people in that market, though, who had something that they were comfortable with, or at least were ready to settle for. They were told that's not good enough. These are the folks who got moved out of other parts of the individual market and ended up with less effective choices and ones they didn't want. And that's what you're mostly hearing from among your constituents.
And that's not going to turn around on its own. I think the President Obama's Council of Economic Advisors, just before they left, asserted that the insurers have now got it figured out, everything's under control. The first 3 years, we had the training wheels on board, but now we're good to go. That doesn't make any sense. You know, last year, from 2016 to 2017, you had by far the worst premium increase, 25% nationwide average. It's not getting better, it's getting worse. It's like the insurers are having more and more trouble every year they stay in the exchange.
Well, I guess my follow-up is when insurance networks have become so narrow that individuals like my constituent, and there's many of those in Indiana, I just talked about one, when they lose access to their doctors, what does that say about the individual mandate's effectiveness to begin with?
I think it says you're on the route to Medicaid for everybody, where there's very poor access to care in many cases. So folks like, I know some of the members have given testimony from their constituents. The whole structure is so terrible. You know, you earn an income that's, you know, you're not Medicaid eligible, so you can't even get the poor access to care that Medicaid offers. You might get some tax credit in the Obamacare. Maybe you make too much money for that. It's hard work to figure all that out, you know, and then the IRS comes after you next year and says you owe money back. So the complexity is far too complex, and I think when you go from one insurer to no insurer, as in Arizona, you were very lucky. I mean, what is a market where there is no insurance offered? Right. It's not a market.
I appreciate it. Mr. Chairman, I yield back.
I now recognize the gentleman